The second question comes from another young man. He says, my 65-year-old mother is always constipated. We have tried many kinds of medications for her without any improvement. Kindly advise me on what next to do. And my answer is this. To help in curing constipation, that it's very important to consider lifestyle changes for your mother. For example, you need to increase the fiber intake for your mother. Aim for about 25 to 30 grams of fiber from fruits, vegetables, whole grains, and legumes, that is beans. Secondly, your mother should take plenty of water, at least about 8 glasses every day. This will reduce the chance of getting constipated. She should also reduce the intake of processed and high fat foods, which can contribute to fat constipation. It's important for her to eat regular meals that are fresh and not too full of processed foods. She should maintain a regular eating schedule to promote regular bowel movements. Again, regular exercise is important here. She should engage in physical activities such as walking, running, or yoga to stimulate intestinal function. She should try to go to the bathroom at the same time every day, especially after meals, so that this routine will make sure that we make it easy for her not to be constipated. Then it is also important that anytime she has the urge to go to toilet, she should respond promptly instead of trying to hold the stool. This will make sure that the bowel movement is regular. Drinking a warm beverage, especially in the morning, can also help to stimulate bowel movements. And again, like I said, you should she should take plenty of fiber, that is fruits, vegetables, and plenty of water. However, if after all this the constipation persists, she should seek medical advice so that if there's any other underlying causes, that one can be taken care of. The third question is about heart disease. And the next question has to do with heart disease. And it goes like this. It said, 2 members of my family have recently been diagnosed with heart disease. Can you let me know what causes heart disease? I also want to know if the diseases are infectious and if they also run in families. And my answer is this. I said there are some heart diseases like hypertension that can run in families. And when you have hypertension, that is, your blood pressure is high, it can damage your arteries over time. Even though not infectious, hypertension can run in some families. And then this can be due to maybe high levels of cholesterol. This can contribute to, over the time, narrowing of the blood vessels and then risk of heart attack and stroke. Also, the other thing that can also augment or make heart disease to be more susceptible is smoking. For example, tobacco smoke contains chemicals that can damage blood vessels and heart tissue. Then, if you also have diabetes, which can also run in families, and it's not well controlled, then this one can also lead to the increase of heart disease, particularly if the blood sugar level is very high over time. Then obesity and physical inactivity, being overweight or obese, especially when coupled with a sedentary lifestyle, can also lead to conditions like high blood pressure, diabetes, and high cholesterol, all of which can increase heart disease risk. And it's important, if you have a family history of heart disease, to make sure that you go for regular checkup. And you also need to make sure that your diet does not contain too much of fat or sugar or salt, and because it can also push you into having this heart disease problem. The other factor that you also need to be against is that you need to do a lot of exercises, go for regular activities like early morning walks, or if you can afford it, go to the gym. This one will also help you. and you must maintain your weight. Losing weight can also help to reduce the chances of having any heart disease. And like I mentioned, your blood pressure must be checked regularly with your doctor, and if it's high, they will put you on some medications. So regular checkups, regular medical checkups will also help you to manage these incidents. If you know you have history, you have people in your family that have heart disease. The next question is from somebody who wants to know whether what is happening to his roommate is tuberculosis. He said, my roommate has been coughing, especially for the past 2 weeks. The cough is also accompanied by chest pain and occasional release of blood-stained sputum. I want to know if this is tuberculosis, and if so, can I not be infected? And my answer is that most people infected with bacteria that causes tuberculosis may not even have symptoms. But when symptoms occur, they usually include what I just said, that is cough, sometimes with a little blood in the sputum, weight loss, then they usually have sweat, they sweat at night, and then they have fever. Then some of them also have chest pains and pain when they are breathing. Then some of them have fever, loss of appetite, and poor appetite. Also common is swollen lymph nodes and all the other things. Since your roommate has some of the above symptoms, it will be important for both of you to visit the doctor so that some tests can be done, so that you know whether your friend has tuberculosis and whether you have also been infected. But don't be afraid, because the treatment for tuberculosis in many hospitals is free and is available. Another question is about tetanus. He said, is tetanus curable? Can you cure tetanus? He said, I went to visit a neighbor's son in the hospital a few days ago and saw him in a very bad shape with severe muscle spasms and difficulty with breathing. I was informed that a rusty nail pierced his foot and caused infection. I want to know if this disease is curable and how can it be prevented. My answer is that the bacteria that causes tetanus is common in the soil. They are living in the soil as a bacteria. It is in the ground everywhere. Even though rust does not cause tetanus, but a rusty nail indicates that it is likely to be in contact with the soil for a period of time, and thus likely it can cause tetanus. If you have a scratch, tetanus is possible because of the likelihood of the organism getting into your wound. A puncture from a nail is also very important. It's also a common cause of tetanus. This is why puncture wounds are taken very seriously. Although tetanus is not curable, but once you develop the symptoms, the disease needs to run its course. But proper treatment can manage symptoms and prevent complications. Tetanus is commonly called lockjaw. Severe complications of tetanus can be life-threatening. Treatment focuses on managing symptoms and complications until the effects of tetanus can be resolved. It is also advisable to avoid tetanus by getting vaccinated with tetanus vaccine. The next question is, how do you manage kidney stones? The question says, I often read of people with kidney stones, which I'm told usually cause a lot of pains. I want to know what causes these stones and how to treat the case. I said, kidney stones are formed when some minerals in the blood get clogged together. The commonest cause in kidney stone is what we call calcium oxalate stone. This one comes in the blood, and when the material clogs the kidney, it can cause this pain. And one of the ways to avoid this is very simple, and that is by drinking plenty of water. Drinking more water is the best way to prevent kidney stones. If you don't drink enough, your urine output will be low. Low urine output means your urine is very concentrated and likely to develop urine salts that will cause stones. And we also know that some diets that have very low calcium in them, low calcium diets, may also increase your kidney stone risk. Therefore, when you take calcium supplements, you may also have kidney stone. And that is why when you take calcium supplements, you must take it with a meal, or make sure you drink plenty of water with it, so that it will not cause the stone. A high salt diet also increases your risk of calcium kidney stone. Therefore, when you reduce the amount of salt you take, it will reduce the amount of kidney stone you take. Other foods that are high in some foods are also high in having calcium. These are important. You should try to avoid or limit them. Things like beef, too much pork, or poultry, that is chicken. And then also avoid vitamin C supplements. This vitamin C that people take regularly when they have cold, you have to reduce it so that it will not give you kidney stone. The next question, it has to do with diabetes. And the question goes like this: I want to know if by avoiding the consumption of sugar, I can avoid having diabetes. And my answer is this: avoiding sugar can only reduce your chances of getting diabetes. However, there is no guarantee that you can prevent diabetes by avoiding sugar, for the following reasons. Number one, diabetes can run in some families, that is, it has a genetic propensity. Secondly, there are some processed food, tin food, and all these imported foods that have high level of sugar, and it can lead to it. Excessive eating of this can also lead to high blood sugar and diabetes. Stress, tension, and worry can also trigger cortisol release. Cortisol is something in the blood that can reduce the action of insulin and also make the liver to produce more glucose. This will lead to high blood sugar and diabetes. Again, sleep deprivation can cause stress and diabetes. This is why it is important for us to make sure that we take care of our health. We take enough fluids, we do a lot of exercises, and make sure we reduce the amount of sugar we take. And particularly for those who know that diabetes runs in their family, or they have relatives with diabetes, all these activities will reduce their chance of having diabetes. Regular check in the hospital for your blood pressure and blood sugar will also help to avoid going to diabetes form. The last question is about oxidants. I want to know what are oxidants, because I've read a lot about what they call oxidants. I want to know what they are and how useful they are to the body. And my question is to say, well, this is a very high level question, because when you are going into all the issues of oxidants, you are talking of chemicals in the blood that can react and produce and cause so many problems. Luckily, the body has natural antioxidant defense systems that will reduce the damage caused by oxidants, because oxidants are chemicals formed in the body that can damage the blood cells, and they can lead to cancer. They can lead to problems with the blood vessels. They can lead to other bad things in the body. However, the body has some chemicals that can help us to break down these oxidants. We call them antioxidants, and they can be found in food. They play a major role in making sure that all these oxidants that damage body cells do not do so. And we can find antioxidants in many of our foods we take: fresh fruits, vegetables, non-processed foods, that is, foods that are not canned. So when you want to avoid having these oxidants that can cause problem for you, make sure that you take fresh food, fresh fruits. Make sure that your food is properly cooked, and avoid intake of processed foods in tin cans, and take care of your health, go for exercises, drink plenty of water, and this way you can avoid these oxidants. So this will be the end of this session, and until I come again, once again, I'm Dr. Wale Okediro, family health physician, 45 years in practice. And in our next episode, we will take more questions that are asked. Thank you for that. Bye.